Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing about another DABT topic, that is glycol toxicity. So around more than 10 questions, around 12 to 13 questions they have asked previously from the year 2000 to 2009 regarding different types of glycols. I tried to collect all the information with respect to glycols. So at least up to 1 to 7 questions we'll be discussing in this video. Rest of up to 7, 8 to 13 we'll discuss in another video. So these are the list of glycols on which previously they have asked in the ABT recertification. That is ethylene glycol, propylene glycol, diethylene glycol, hexylene glycol. One of the options was there. Ethylene glycol, monomethyl ether, ethylene glycol, monoethyl ether, and propylene glycol, monomethyl ether. Okay. So first question we'll discuss about. The first question was taken from the year ABT recertification question paper, year 2009. The question was, which of the following is not correct regarding ethylene glycol? So we from the below options, we need to identify which of the following statements is applicable with respect to ethylene glycol. So ethylene glycol is rapidly degraded in the environment. So this option is something related to biopersistent or lipophilicity or hydrophilicity, how the particular chemical will degrade into the environment. Second option is ethylene glycol, its toxicity can include metabolic acidosis. So this metabolic acidosis you will come across with respect to ethanol poisoning, methanol poisoning also. Third option is ethylene glycol exposure may result in hypocalcemia. So will there effect on the, so whenever there is certain type of poisoning, no, there will be uh, what is it? Different ion metabolism, ion homeostasis will be changing. For example, hyperkalemia or hypokalemia, hypocalcemia, hyponatremia or hypernatremia. These ions need to be stabilized in the body fluids. So that is the reason here that the option is ethylene glycol exposure may result in hypocalcemia. And fourth option is ethylene glycol is carcinogenic in mice. Whether ethylene glycol is going to cause any cancer, that we will study in detail. And next, ethylene glycol can produce developmental toxicity. So some of the glycols, they have the characteristic feature of causing reproductive toxicity. So what are those glycols will be seen. So right answer will be in the green texture. That is, question is which of the following is not applicable with respect to ethylene glycol. So right answer is ethylene glycol will not cause cancer in the case of mice studies. So there were some studies which were conducted in the mice and rat. They found negative. There was not carcinogenic in the case of mice or rat. 2-year lifetime carcinogenicity studies. Okay. So before going to the next slide, let's quickly go through the metabolism of ethylene glycol. So similar to that of the ethanol, that is ethyl alcohol or methanol, ethylene glycol will undergo metabolism by the action of the enzyme alcohol dehydrogenase. So ethylene glycol, this is the structure of ethylene glycol. So it is undergoing metabolism by alcohol dehydrogenase, and there will be formation of glycoaldehyde. So aldehyde will be formed. In the case of alcohol, ethanol also, what is the metabolism you see? Methanol also same. Okay. Then after action upon by another enzyme, aldehyde dehydrogenase. What is the metabolite? It is formed glycolic acid, which is also toxic. So glycoaldehyde is toxic. Then glycolic acid is toxic. Then further undergoes metabolism in your body to form glyoxylic acid. And the last product which is forming is oxalic acid. In the case of methanol, it is formic acid formation will be there, which causes eye toxicity, ocular toxicity. So like this, you have to remember what is the solvent or what is the chemical, what are the enzymes which are acting upon, and what is the toxic metabolite. So in the case of ethylene glycol poisoning, oxalic acid is formed. This oxalic acid, they get precipitated in your urine as well in your kidney. As a result, kidney stones or kidney toxicity you can see. So we'll see what are the, this is the histopathology of, you can see, and these are the what is it, under fluorescence microscope, you can see the urine color change, as well as these are the calcium oxalate crystals. Okay, so the key toxic effects of these metabolites. What are those metabolites? Glycoaldehyde, glycolic acid, glyoxylic acid, and oxalic acid. Metabolic high anion gap acidosis. This is very very important. So physician has to correct this. If there is any metabolic acidosis, anion gap acidosis is there. The physician has to address to the patient, has to correct this one. Second one is calcium oxide crystal deposition in the kidney, that is called acute kidney injury. Third one is hypocalcemia. So in our option we had hypocalcemia, CNS depression. So most of the solvents, no, they're going since because of their what is the lipophilic nature, they can cross the blood-brain barrier. As a result, they will cause CNS toxicity. In the case of ethanol also, you can see the same thing. Then possible multi-organ damage. So what are the target organs might be? It might be CNS, it might be liver as well as kidney, but there is no effect on the cancer. In addition, remember some of the glycos will cause reproductive toxicity. Okay, so they are affecting your male fertility as well as female fertility. Clinical features will see CNS depression, inebriation, nausea, vomiting, abdominal pain, tachypnea, seizure, coma, acute kidney injury. Okay, so this was regarding about ethylene glycol. The first question was taken from the year 2009. So first two things we try to address in the next two slides. That is whether ethylene glycol will cause reproductive toxicity, whether ethylene glycol will cause carcinogenicity or not. So first one is yes, ethylene glycol will cause reproductive toxicity in animals. So what are those animal studies we'll see at doses that produce systemic toxicity. So another very important thing that you have to remember is whenever there is some toxic effect, at what concentration, at what dose it is causing. So these all these adverse effects on the reproductive system, whether male reproductive system or female reproductive system, they're happening at a systemic dose. Okay. So what is ethylene glycol? Ethylene glycol is a colorless, odorless, sweet tasting liquid. That is why it is used in the pharmaceutical preparation, okay, as a solvent. In some of the questions, you might get instead of ethylene glycol directly giving, they might give you synonym, that is antifreeze they will give. Okay. Second thing, this metabolism we have discussed. Again, you also go through. You can pause the video and go through systemic effects, metabolic acidosis, oxidative stress. So this is the thing by which cell will be deprived of the um, free radical formation. With this, cell will undergo either necrosis or apoptosis, calcium oxalate deposition, organ damage, kidney, CNS, and liver. These effects can impair reproductive organs and hormone imbalance. So this was about the mechanism. Coming to reproductive toxicity, generally reproductive studies, we have segment 1, segment 2, and segment 3. Segment 1, it is done in male and female to understand whether there is an adverse effect of a certain testing chemical on the male reproductive system or female reproductive system. So in both fertility studies were conducted with ethylene glycol in both mice and rat, and they found that there is a decreased fertility, reduced mating, conception rates, increased pre-implantation loss. Coming to developmental toxicity, generally segment 2 studies are done in rat and rabbit, two species recommended by the FDA guidelines or ICH guidelines. But in addition, with respect to ethylene glycol, they have also done in mice, and they found that there is increased resorptions, fetal growth retardation, okay, skeletal and soft tissue malformation. So read about these two types of malformations also to understand EFD studies, embryo fetal developmental studies. Third one is multi-generation studies, in which the test item is given to the testing animals for F1 generation, F2 generation also. So effect on reproductive performance in F1 generation at higher doses. Again, very important. At what dose? At systemic exposure. Okay, so final conclusion is reproductive toxicity observed at doses causing maternal toxicity. So in the case of embryo fetal development also, if you're giving certain, for example, 100 mg of the drug to the pregnant rat or rabbit, if the mother is showing certain type of symptoms, obviously it means that definitely baby will show, embryo or fetus will also show some kind of adverse effects. That is called with maternal toxicity. For example, in the case of thalidomide, what happened? Mother appeared to be fine, but the baby, after giving the birth, showed adverse effects. So certain times, in the case of risk assessment, that kind of example will go without maternal toxicity. That is reproductive toxicity, embryo fetal or teratogenicity or fetal toxicity without maternal toxicity. Example is thalidomide. Okay, so that is the thing. So you can pause the video and see how the key effects on the reproductive organs, how it is affecting decrease in the sperm count, how it is affecting in the case of female estrous cycle. Okay, and human relevance limited. How you are going to, once you get the animal data, since these glycals have historically we have an enormous amount of data is there. So from the epidemiological studies also you can, limited human data is there. High exposure may affect the reproductive health. So in the case of workers also, you can collect samples, blood samples or samples like that. From the survey, from the samples also you can conclude. So final conclusion can cause reproductive toxicity, and animals at doses produce systemic toxicity. It is considered as potential reproductive hazard. Exposure should be minimized, especially in the case of environmental settings. Okay, pause the video and see what are the different ways you can protect the workers. Okay, so now we'll see whether ethylene glycol has an adverse effect on the whether it is going to cause cancer, either in the, because in the option we had mice. So we'll see But in the case of mice, as well as in the case of rat, what are the findings that we have? So, is ethylene glycol carcinogenic in mice, rat, and human? This is the question. Overall conclusion is ethylene glycol is not considered carcinogenic in the case of mice, rats, and humans based on available evidence. What are those evidence we'll see? So they have done long term, that is 2 year or 1 or 4 week or lifetime cancer study in the case of mice, and the conclusion was not carcinogenic. In the case of rats, also 1 or 4 week study was conducted. The conclusion was not carcinogenic. Based on humans, since I told you, these glycols have a history of use in the case of patient, the human population. So from those epidemiological studies, they couldn't establish any link with the cancer. So the overall conclusion is not considered carcinogenic in the case of humans. Okay. So important uh, if you look into the regulatory classification also, major regulatory agencies they did not classify ethylene glycol. For example, IARC, US EPA, NTP, ACGH, ECA, in more all these organizations, this is not classified as either carcinogen or it is not been listed, ethylene glycol. So this was the bottom line is ethylene glycol is not considered carcinogenic in the case of mice, rat, based on current scientific evidence. In future, if there are any studies at higher doses and if they found any findings or it has been done in some other species, then we can see. Okay, another thing that you have to remember with this particular slide is that, see, what we are having, we have animal test, then we have negative in genotoxicity studies, then we have human evidence. So this is called weight of evidence approach. Not from a single study conclusion. We are checking in the case of mice, we are checking in the case of rat, we are seeing gene tox data, and we also checking human, that is epidemiological evidence. Overall, then you are coming to weight of evidence approach, stating that this particular thing is not carcinogenic. So that was about the one type of glycol, that is ethylene glycol. So next question we'll see, which was asked in the year 2007, ABT recertification question paper, year 2007. The question is, which of the following is ultimately metabolized to oxalic acid? If you remember this particular ethylene glycol metabolism, the answer is in green text, that is the ethylene glycol. Okay, so to confuse you, the examiner also included option B, that is propylene glycol. The rest of the things you can neglect, that benzene, naphthalene, or sodium hypochlorite, but you will get confused with respect to propylene glycol and ethylene glycol. But if you remember very carefully ethylene glycol metabolism, then you can easily answer this in your exam. Next question we'll see. This question was asked in the year ABT recertification year 2005. Ethylene glycol, renal toxicity, kidney toxicity is not characterized by which of the following. So we have seen different key points with respect to ethylene glycol poisoning. The right answer is accumulation of formic acid. Formic acid, here the final product, the metabolite, the toxic metabolite formed is oxalic acid. Formic acid you can see in the case of methanol poisoning. Okay. So other things you see options, focal hemorrhage necrosis in the case of cortex, metabolic acidosis, calcium oxalate crystals in the case of urine, mild inebriation. Mild inebriation also given in the first slide, if you second slide, if you remember. Okay, these are the thing. Focal hemorrhage, that is the, since it is able to cross the CNS, it is causing focal hemorrhage necrosis in the cortex. Here you can see the calcium oxalate crystals in the urine, and this is the typical HNE stain histopathology of this slide. So these were the two questions which were asked in the year 2007 and 2005 with respect to ethylene glycol. 2009 we have discussed. Now we'll see another question with respect to glycol poisoning only. This is very interesting question. This question was, I was unable to trace out in which year they have asked, but it is in between 2000 to 2009 ABT recertification question paper. The question is, the addition of rabbits to the preclinical testing of the drugs for teratogenicity was initiated due to, so initially, before thalidomide tragedy, this particular, if for the case of embryo fetal developmental study, that is segment 2 studies, they generally used to do in one species, that is rat. Okay, if you look into segment 1 study, that is fertility study, and segment 3 study, that is prenatal postnatal study, uh, the test species is rat. In the case of segment 2 study, embryo fetal developmental study only, we are conducting in two species, rat, that is rodent, and rabbit, that is mammal. Why? Because uh, during this particular thalidomide tragedy incident, no, uh, there is a small misconception. People think that enough number of toxicology studies have not been conducted. Before that, only animal was given, the drug was given to the pregnant population. Of course, the drug was used in European population. As I told you, the teratogenicity was found without maternal toxicity. The mothers were appeared to be fine. Children were affected after giving birth. They were showing phocomelia or lower small limbs like that. So this was a completely new learning for both pharmacologists as well as toxicologists. Okay. And another thing, the reason why thalidomide failed is that this thalidomide exists in enantiomer. It exists in both R form as well as S form. Okay. So if you understand in our body this enantiomers they interconvert. Okay. The structure of thalidomide is asymmetric carbon are equally active as an interconvertible in the body. So these type of isomerism, this conversion in our body was also at that time was not fully studied. These were the two reasons because of which the drug the adverse effects with teratogenic effects were not detected in the animal studies. Post this strategy, they decided that there are certain, this is important. Again, pregnancy window is important. The pregnancy window in the case of rat is not similar to that of the pregnancy window in the case of human beings. So rabbit has certain period pregnancy window which mimics which that of the human. So in order to safeguard the drug, the regulatory agencies, whether it is FDA or other ICH agency, whatever, they have included both mice as well as rat, that is rat as well as rabbit. They included both rodent as well as mammal in the battery of reproductive toxicology studies. As a result, so some of the pregnancy adverse effects, if they are not able to identify in the case of rat, the same can be captured in the case of rabbit. So these were the reasons. So we'll see the right, what is the right answer. The birth defects associated with the thalidomide. This is the reason why addition of rabbits to the preclinical testing of the drugs for teratogenicity was initiated. So very important. Pause the video, understand why. You see, if you see segment one, that is fertility studies as well as prenatal postnatal studies, only one species, rodent only we do. EFD studies, we do rat and rabbit. Okay, this is the thing. You can pause and look into why the other options are right or not. So option 4, they have given sulfanilamide research and passage of the Copeland Bill in 1938. Please pause the video and go and read about sulfanilamide elixir tragedy, this Copeland Bill in 1938 also. Few questions on this particular sulfanilamide elixir also they will be asking in the exam because that is associated with diethylene glycol toxicity. Okay. Now we'll see question number 5. Question number 5 is taken from ABT recertification year 2004. The question is glycol associated with kidney toxicity include. So what are those? Is diethylene glycol and ethylene glycol. So in the previous first, second, third slide we have seen ethylene glycol target organ we are having kidney. So similarly, in the case of another type of glycol, that is diethylene glycol, it is also causing kidney toxicity. Important thing that you have to remember here, pause the video and see. See, propylene glycol and ethylene glycol, they are not having kidney as a target organ. So this is also you have to, because in this question, all options they are given glycol. Then it becomes confusion for you. So you have to remember like that. Okay. So we'll see. You can pause and look into the more details about the structure of the thalidomide, how the interconversion is there between S and R isomer. So we'll now quickly go through sulfanilamide elixir because this is something associated with diethylene glycol. Okay. Uh, this in 1930, sulfa drugs were widely used to treat bacterial infection. Okay. So this is an antibiotic. Sulfanilamide, a sulfa drug, was poorly soluble in water. So this makers, the manufacturers were there, that they wanted to come up with a utilization of a solvent in order to dissolve the sulfanilamide. So they decided let's go with diethylene glycol because it is also having some sweetening taste, and this particular drug sulfanilamide will dissolve in this diethylene glycol. So this particular company, okay, USA dissolved sulfanilamide in diethylene glycol instead of the required solvent, that is propylene glycol, to make elixir sulfanilamide. Generally, what happens, once you prepare this particular preparation, before administration, it has to be shaken. Once you keep it in the shelf, the sedimentation will be there because of the density changes. As a result, medicament will be on the supernated layer and glycol will is submitted at the bottom because of the density changes. Okay, this is the error. What could have done is label instructions should have been clearly mentioned that shake before administration. So this made this particular failure has triggered the FDA that we labeling of these products, this of the drugs is also very very important. Okay, so diethylene glycol is highly toxic. It was used to reduce Yeah, see, these companies at the end they want to make money, so you understand the reasons. So diethylene glycol was used as a solvent in the manufacture of sulfanyl elixir. The product looked and smelled, taste similar to that of other medicines. Physicians prescribed it confidently for infection. Patients, including many children, consumed it. So generally, in the case of children who are still, whose some of the organs are still under developing stage, so kidney was most affected in these children. It called acute kidney failure, and many children died. Okay. Within days and weeks, thousands of patients developed symptoms of poisoning, nausea, vomiting, abdominal pain, kidney damage, that is acute renal failure, and death. More than 100 people died, including many children, in the United States in 1937. Okay, so time, they pause and look into the timeline. So, what is the important outcome is one of the deadliest drug disaster in the history. Public outcry demanded government action, as I told you, led to the passage of Federal Drug and Cosmetic Act, that is 1938 in the USA. The act required drug manufacturer to prove safety before marketing. So, whatever, not only the API, complete formulation should be safe, and labeling is also very important. Proper labeling and company responsibility. It is a responsibility of the FDA. Was painful, directly led to the modern drug regulation and protection of millions of lives. What my understanding as a toxicologist is that most of the things we try to write in the form of acts or guidelines, or but whenever such disaster happens, no, which cannot be addressed with the existing guidelines, then only it will be a new learning to the scientists. Then we'll come up with a new act, new bill, or new guideline. Okay, so look into the complete history, it is like always like that only. Okay, so next you will see, next questions were asked from the year ABT recertification year 2005. So both these questions were asked from the year 2005. So go for before going to, I will request you pause the video and read about the previous slide in detail. Okay, so which of the following is not associated with spermatotoxicity in the case of rat? So this is important, as I told you, glycols, they're going to affect reproductive toxicity, male as well as female reproductive organs, male fertility, that estrous cycle in the case of female. So right answer is propylene glycol monomethyl ether. This particular type of glycol ether, they are not having any effect on the sperms in the case of in the case of rat. But ethylene glycol monomethyl ether, ethylene glycol monoethyl ether, ethoxyacetic acid, and methoxyacetic acid, all these things are going to have adverse effect, that is spermatotoxicity in the case of rats. This is very very important. You have to remember. Options also you see, almost all glycos they are giving. And if you look into this ethoxyacetic and methoxyacetic acid, they are not glycos. They are the metabolite products of these particular glycos. So like this also they'll try to confuse us. So you have to remember, there's no other way. Today also we have glycols disasters are still taking place, whether in the case of Africa or in the case of India, also Jammu, some of the cup syrups which are contaminated with these glycos, children, a number of children have died because of the acute kidney injury. So still, it's a topic for the FDA to ask regarding glycol toxicity in the exam. Okay. Next question we will see, question number 7. Which of the following solvent requires metabolic activation to induce toxicity? So we have seen ethylene glycol metabolism. So some of these solvents, as such, the parent molecule will not cause toxicity. After metabolism, formation of toxic metabolite, they will cause toxicity. So here the right answer is all: benzene, N-hexane, ethylene glycol monoethyl ether, and carbon tetrachloride. So all these four options. This is the information given by the previous DABT students. I checked into this from the chat GPT. I'll tell you the right answer which I got. The right answer it states that only A and D are correct. Benzene and carbon tetrachloride, they require metabolic activation to induce toxicity. So pause the video and go through, because in this particular slide, very clearly they have given what are the toxic metabolites. If you look into benzene, it requires metabolic activation. If you look into carbon tetrachloride also, formation of free radical is there. So that's why it is also requiring metabolic activation. Coming to N-hexane, no? Actually, hexane is also having, I have made one video with respect to hexane also. There is a formation of this particular toxic product called 2,5-hexane-dione. That is at a gamma position, W position. That is gamma oxidation takes place actually. So, but it states it does not require. But with respect to hexane, no, I have made one video. I have taken from the lesson only the notes. I'll give the link in the description, so you also go through. Coming to ethylene glycol monoethyl ether, it is forming ethoxyacetic acid. So these options we have seen in the previous slide also. So conclusion is it is not containing requiring metabolic activation. So I will request you to pause and understand they will try to link and ask the questions like this only. Okay. The answer which I kept in the previous slide is from the previous students, but go back to the textbook and read. That is also very, very important. So hope from this video you were able to learn about different glycols toxicity. There will be next video will be there from the question number 8 to question number 30. In that video, I will try to give concise a table where all the glycols will be compared in a single one slide. Okay, so that at the time of exam you can remember it in a better way. Okay. Thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka@gmail.com. All the best for your exam.